And I'm very glad to say that Tash has done just that. And she runs Skin Envy. Is that right, Tash?
Hi, yes, that's right. Thanks, Robert.
So where are you based? Are you here in London?
Yes, absolutely. Yes, we're very much in London. We're actually in Isleworth.
Okay. And what sort of treatments do you offer?
So we do quite a large range, and it does involve some of the injectable treatments, but it can involve some of the more superficial treatments as well. So the range of treatments we do include things like botulinum toxin, which is Botox, dermal fillers, something called Profilo, but we do have more of the surface treatments, so chemical exfoliations, microneedling, mesotherapy, things like that. So there's quite a large range, and you can choose what you would like to have done. Depending on what I think you were talking about earlier is the invasiveness of the treatments. You've got full choice as to what you would like to venture into effectively.
And is that something that's done by both male and female?
Yes, absolutely. So there's a lot more awareness within the male population nowadays, but I think that the association with beauty kind of comes more with the female population first. But I have to be honest with you, husbands, boyfriends, brothers are becoming more and more aware as their partners are actually being more involved in this industry.
And have you seen a big surge since you've been allowed to come back? Has it been busy?
Yes. It has, absolutely. And I think it's become a lot easier for us to divide our attention because we have online and offline appointments now. So these are resources that weren't actually in action before the lockdown. But because we were able to split it up, patients who were not able to make appointments in clinic for whatever reason, schedules, children, work, or, work purposes, we are able to offer more online resources. So because we're more available, I feel that everyone is accessing us a lot more so definitely a lot busier.
And have you had to change the way that you operate?
Absolutely. Absolutely. So I think the way that we are implementing within clinic has 100% changed as a result of the pandemic, a lot more requirements. And in terms of the virtual consultations, that's a new step. Being medically trained, you're never taught how to communicate over the internet.
No,
it's all been about interactions in person. Absolutely. So that's one thing that we've had to learn, how to make sure that we can keep the patient or the client very comfortable, even though we're not in their presence. And on top of that, we need to also change our systems, so our booking systems, and even the consultation forms. We've tried to implement that all online. And what that's allowed us to do is actually dedicate a lot more time to the patient or the client in the actual consultation or treatment appointments, which has actually really worked quite nicely. I've actually been able to speak to my clients for a lot longer and a lot more in depth about what concerns them because we've done all of the admin aspects all beforehand online.
If people are interested, where can they find out more?
Exactly. Absolutely. And the thing is, there's so many resources. So because of the time that we had working on from home, we've actually been able to improve the online resources, so the websites, the social media aspect of it all. So the amount of information now readily available online, and I do feel this is going to continue, is a lot more, accessible. So if they don't have to attend something in clinic any longer to get more information. There's a lot more out there for them to find out.
Where can people find out more? Give us the website address.
Absolutely. So it's www.skinenvy.co.uk, and the Instagram handle is @skinenvy, all one word, _UK. If you can just follow me, pop me a message if you have anything at all. But I'm hoping that my website can answer a lot of the questions. But other than that, I'm up for a challenge.
Tash, thank you.